Senior Care in Decatur, Georgia. March is National Colorectal Cancer Awareness Month. Recommended screening is an incredibly critical part of preventive care. Colorectal cancer is a specific thing that all seniors should really be screened for. March is dedicated to making men and women conscious of this illness. It is the second main cause of deaths attributable to cancers that have an effect on both genders, and 90% of individuals diagnosed with colon cancer were over 50. It is highly recommended that screening starts at age 50 and continues on right up until age 75. There are totally different tests that should be administered regularly to test for colon cancer. A colonoscopy ought to be completed one time just about every 10 years. While in this procedure, the large and small bowels are viewed with a tiny camera. This is done to identify and remove any polyps and is imperative to premature cancer identification. The first colonoscopy should be done at age 50. While a colonoscopy allows for the exploration of the entire 4 to 5 feet of the colon, a flexible sigmoidoscopy permits the sigmoid colon or the final 2 feet to be viewed. A colonoscopy is a recommended procedure over sigmoidoscopy. However, a sigmoidoscopy is shorter. A sigmoidoscopy should be given every 5 years. A fecal occult blood test is a method of colorectal cancer screening that should be completed on a yearly basis. This will require a stool sample being routed off to a lab for testing. Chemicals are used to find blood that cannot be seen. If blood is found in the stool, further testing is mandatory. A patient may be referred for colonoscopy. A double contrast barium enema may be used every 5 years for extra testing. This is a procedure in which an X-ray of the colon is taken. The barium used in this assessment highlights the large intestine. It is at the same time delivered to expand the colon, allowing for clearer images. The barium will pass out of the body with stools. Anyone between the ages of 50 and 75 should have standard testing for colorectal cancer. Assessing should be started off earlier with family history of colorectal cancer or with a diagnosis of inflammatory bowel disease. Testing is also recommended in some seniors who are over the age of 75. Talk to your primary care physician about colorectal cancer screening today. Comfort Keepers provides in-home caregivers in Decatur. For more information about caregiver services, please call us today at 404-850-9200.